It's Nick the Nurse here. Today we're going to be talking about the signs and symptoms of the nursing problem SIADH, or Syndrome of Inappropriate Anti-Diuretic Hormone, which herein will be referred to as SIADH because it's a long name to pronounce. Signs and symptoms include low urine output, dark concentrated urine, hyponatremia, headache, weakness, anorexia, hypervolemia, weight gain, hypertension, nausea and/or vomiting, seizures, tachycardia, mental status changes, diminished deep tendon reflexes, abdominal cramping, oliguria, crackles heard on lung auscultation, right, because you're going to be holding fluid, jugular vein distension, stupor, and coma. All very good signs and symptoms that you need to know in order to do well on your nursing school exams, but there are a few that you really need to own in on and pay attention to. Low urine output. You have to know this. As I said in our other video on risk factors for SIADH, you as a good nursing student, if you want to pass your nursing school exams and do really well on the NCLEX to achieve your dream of becoming a licensed or registered nurse, need to know the difference between SIADH and diabetes insipidus. Now, recall, with diabetes insipidus, you have a lot of urine output, where with SIADH, you have virtually none. You're going to have oliguria. You're just not going to have a lot of urine output. It's going to be scant, okay? So low urine output, definitely something you need to automatically associate with SIADH. Hyponatremia. Why? Because the sodium in the body in relation to the amount of fluid that's going to be retained is going to cause the relative amount of sodium to be low. So kind of keep that in mind as well. Hypervolemia, rather, because you're going to have excess fluid. That's in contrast to hypovolemia that you might see with diabetes insipidus. So you have to know the hyper and hypo of the ADH disorders on your nursing school exams and on the NCLEX. You have to know this stuff. If I were to say, is low urine output associated with SIADH or is it associated with diabetes insipidus, you should automatically say SIADH. You've got to know this stuff. So those are easy points. They're low-hanging fruit on your exams. Make sure that you know them. Again, my name is Nick the Nurse. I'd like to thank you for watching this this video today. If you'd like to check out any of my other completely free videos, they're all located at www.nickthenurse.com. Again, that's www.nickthenurse.com. You can also check me out on YouTube on my channel, Nick the Nurse. Thanks for watching, and I'll see you next time.